Attention Deficit Hyperactivity Disorder, ADD/ADHD. It is the attention deficit disorder with hyperactivity, or hyperactivity disorder/movement, ADHD, a chronic condition that affects millions of children and will accompany even in adulthood. Among the problems that are attributed to ADHD are lack of attention, hyperactivity, and impulsive behavior. Children with this disorder particularly suffer from low self-evaluation, problematic social relationships, and low achievement in educational settings. Although the treatment available for this disorder cannot cure it, it may contribute to treating the symptoms of the disorder. Treatment usually includes psychological counseling or appropriate drug administration, or it may consist of a combination of both. A diagnosis of the disorder may trigger feelings of fear, even terror. The symptoms that accompany the disorder can also be a challenge for parents and children alike. However, the treatment of this disorder may be a positive turning point, and thus most children who suffer from the disorder may reach to be effective, full of life and successful. Symptoms of attention deficit hyperactivity disorder. ADHD consists of a combination of two terms for attention deficit disorder, ADD, which is associated with hyperactivity disorder. The term ADHD expresses the two main components of the disorder, attention deficit and hyperactivity disorder associated with impulsivity. Although some children with ADHD suffer from one side of this equation, most children suffer from a mixture that includes both disorders, attention deficit hyperactivity disorder and hyperactivity disorder. In particular, the first signs and symptoms of ADHD appear when activities that require focus and mental effort. Most children diagnosed with ADHD develop signs and symptoms of ADHD before the age of 7. Even the first symptoms can appear, in some children, at a younger age, such as during breastfeeding, for example. Symptoms that indicate attention deficit disorder include the child's inability, most of the time, to pay attention to details or make some mistakes due to the lack of attention in preparing his homework, or when performing other activities. The child's inability, most of the time, to remain alert while performing certain tasks, schoolwork, or while playing. The child appears to not listen to what is being said to him, even when addressed directly. The child shows difficulty in implementing or following instructions, and most of the time he does not succeed in completing his homework, or other duties. The child exhibits difficulty in organizing while preparing homework or while carrying out other tasks. The child avoids fulfilling the duties he does not like and that require intellectual effort, such as homework at school or homework. Often children with this disorder tend to waste their things, such as books, pens, toys, and tools. A child with this disorder can be distracted very easily. Often a child tends to forget some things. The child exhibits uneasiness, nervousness, and a lot of writhing. The child tends to leave his sitting position in the classroom, often, or finds it difficult to sit in his place for a long period of time in cases that are expected to do so. The child tends to run or climb. And often he performs these behaviors in an exaggerated manner and in a way that is not commensurate with the situation. Most of the time a child cannot play with peace and quiet. The child appears always active and mobile most of the time. The child tends to talk excessively. The child tends to answer before he finishes hearing the question, before hearing the whole question. Most of the time the child cannot wait for his turn and stick to the role. The child tends to interrupt speech or get confused when others are talking or playing. Symptoms that indicate hyperactivity and impulsive behavior disorder include: there is a difference in the behaviors of people with ADHD between boys and girls. Boys' behavior is predominantly hyperactivity, while girls are less likely to be attentive. The lack of attention in girls is mainly daydreaming, while the hyperactivity of boys is the tendency to play or be preoccupied with things that are silly and not targeted. Boys tend to be less listening and follow the instructions of their teachers or other adults, which makes the problematic behavior more noticeable and prominent. If you notice that some of your child's behaviors are frequently hyperactive or inattentive, there may be room to suspect that your child's behavior is due to ADHD. If these behaviors continue for a period of time that exceeds 6 months, the occurrence of these behaviors in more than one setting, often, both at school and at home. If the child is constantly nagging at school, whether during play or during other daily activities. If the child's relationships with adults or with his peers from among the children are problematic. Normal behaviors versus behaviors in an ADHD setting. Most healthy children suffer from a lack of attention, hyperactivity, or impulsive behaviors at some point in their lives. For example, parents may worry about their 3-year-old's behavior if he does not listen to a story they tell him from beginning to end, and they suspect that not listening to the whole story stems from his ADHD. But most school children tend to be concentrated for short periods of time, and thus they are not able to continue doing one activity for a relatively long period of time. In addition, the area of focus for students of school age, or even for adults, often depends on their interest in the topic of the activity. Teens may be able, for example, to listen to music or talk to their friends for hours, while they find it difficult to concentrate for a long time when preparing their homework. This holds true for hyperactivity, too. Babies naturally enjoy high vitality, as they cause their parents fatigue before they themselves become tired. In some cases, children may become hyperactive after becoming stressed, hungry, anxious, or exposed to a new environment. In addition, some children, by their nature, are more lively than others. Therefore, no child should be classified as having ADHD just because they behave differently from their siblings or their peers. It is not correct to classify children who show some problems in their behavior in the context of school, only while they behave normally at home or when playing with their friends, as having ADHD. This applies to both types, i.e. children with hyperactivity disorder, as well as those with attention deficit disorder, as long as their actions do not harm their relationships with their friends or the performance of their homework. Causes and risk factors of attention deficit hyperactivity disorder. Many parents tend to blame themselves when diagnosing their child with ADHD, but researchers are increasingly convinced, over time, that the factors causing the disorder are due to genetic traits, not to bad or wrong choices made by parents. At the same time, there are certain environmental factors that may influence or exacerbate a child's behavior. Although only a few mysteries of attention deficit disorder have been revealed, researchers have been able to identify some factors that may have an effect on this disorder. Change in brain structure or performance. While the exact cause of ADHD is still unknown, brain scans have shown that significant changes have occurred in the structure and functioning of the brain in people with this disorder. It has been observed, for example, the presence of reduced activity in the brain regions responsible for activity and attention. Heredity: ADHD appears to be transmitted genetically, from generation to generation. Research has indicated that 1 out of every 40 children suffering from the disorder has at least one family member who suffers from the same disorder. Maternal smoking during pregnancy, use of addictive substances and exposure to toxic substances. A pregnant woman who smokes increases the likelihood of having a child with ADHD. Also, excessive consumption of alcoholic beverages and the abuse of addictive substances during pregnancy would cause a decrease in the activity of neurons that produce chemical messengers between nerves, neurotransmitter. As are women. Pregnant women who are exposed to environmental toxic pollutants are more likely to give birth to children with the symptoms of a lack of focus and attention disorder. Risk factors that increase the risk of developing ADHD include exposure of the fetus to toxic substances, smoking, drinking alcohol, or consuming addictive substances during pregnancy, a family history of ADHD or other behavioral or psychological disorders, preterm birth. ADHD is often accompanied by other phenomena, including overactive thyroid, hyperthyroidism, learning dyslexia, or genius, oppositional defiant disorder, complications of attention deficit hyperactivity disorder. Children with ADHD may face many difficulties in their lives after having this disorder, including often they face difficulties during educational lessons, which may cause failure in educational achievement, in addition to being subjected to constant criticism, whether from their colleagues or adults. They are more likely to be involved in various accidents, to suffer blows or wounds, than other children who do not suffer from this disorder. They have difficulty cooperating with peers or adults, are at greater risk of alcohol consumption and substance abuse, or are more likely than others to be at risk of delinquency. Other related disorders. Attention deficit disorder does not directly cause other psychological or developmental problems, but children with ADHD are more likely to have other disorders that result from this disorder and that result from it, including oppositional defiant disorder, behavioral disorders, depression, learning dyslexia, Tourette's syndrome, diagnosis of attention deficit hyperactivity disorder. There is no single test to diagnose ADHD, which can make it difficult to diagnose ADHD. The best way to diagnose this disorder accurately and to rule out the possibility of many other disorders that may affect children in childhood is to collect as much information as possible about children with ADHD. The first stage of diagnosis begins with a comprehensive medical examination of the child, during which questions are asked about the child's general health, medical problems, signs or symptoms, and other problems and issues that may appear in the vicinity of the school or home. Children with ADHD show signs over a long period of time, and they show great difficulty in particularly stressful situations, or while doing an activity that requires a high amount of attention and focus, such as reading, solving math problems or thinking games. Most doctors believe that it is incorrect to classify a child as having ADHD unless he or she has clear and critical early childhood signs and symptoms that permanently create problems at home or at school. Criteria for diagnosing attention deficit/focus disorder/hyperactivity disorder. To confirm a diagnosis that a child has ADHD, they must have at least 6, or more, of the symptoms listed in at least one of the following 2 categories: or 6, or more, at least of the symptoms from each of the two categories. Attention deficit category. The child's inability, most of the time, to pay attention to details, or his tendency to make mistakes due to lack of attention on homework or while performing other activities. The child's inability, most of the time, to remain vigilant while completing tasks, assignments, or while playing. The child does not listen to what is said to him, even when directed to him directly. Show the child difficulty in following and implementing instructions, his lack of success, in most cases, in completing school homework, or tasks assigned to him. The child's failure here does not result from his objection to the implementation of duties or his lack of understanding of the instructions. The child has difficulty organizing when carrying out duties or other tasks. The child's refraining from performing tasks he does not like, or tasks that require intellectual effort, such as school homework or homework. The child's tendency, often, to waste and lose his things, such as toys, homework, pens and books. The child can be distracted, with remarkable ease. The child's frequent tendency to forget some things and issues. Hyperactivity or impulsivity category. The child appears uncomfortable, moves his hands and feet nervously, and often squirms on his seat. The child tends, a lot, to leave his seat in the classroom, or is not able to stay in his seat for a relatively long time, when expected in some circumstances. The child tends to run or climb, and perform these behaviors, sometimes, in an exaggerated manner and disproportionate to the situation. In adults, this condition is often a lack of comfort. The child's inability to play with peace and quiet, most of the time. The child appears to be in constant motion most of the time and behaves as if he is motorized. The child tends to speak in an exaggerated manner. When asked, the child tends to answer before he hears the whole question. The child cannot wait for his turn most of the time. The child tends to interrupt speech or disturb others while talking or playing. In addition to being compatible with 6 of these symptoms, which are mentioned in each of the 2 categories, a child is considered to have ADHD when the child shows signs of hyperactivity and impulsivity that lead to abnormal behaviors, abnormal, before reaching the age of 7. He behaves in unacceptable behaviors that do not fit with those of normal children who do not have ADHD. These symptoms appear for a period of time greater than 6 months. The child shows signs of improper behaviors within the school setting, in daily life at home and in his relationships with those around him, so that these behaviors appear in more than one environment, as if they appear in the school setting and at home, too. In addition, a child with ADHD receives a more specific, local diagnosis. For example, attention deficit and focus disorder, when a child has at least 6 of the symptoms that fall within the symptoms of attention deficit and focus disorder, which were mentioned. ADHD disorder/hyperactivity and impulsivity, when a child has at least 6 of the symptoms that fall within the list of symptoms of hyperactivity or impulsivity, which are mentioned above. ADHD disorder/combination, when a child has at least 6 symptoms that fall into each of the 2 categories mentioned above. Other disorders that may be similar to ADHD. The attending physician may want to conduct some tests to test the various possibilities and causes that lead to the abnormal behaviors in the child. There are a number of medical conditions that may cause symptoms that are broadly similar to those of ADHD, including learning dyslexia or language difficulties, a psychological disorder, such as anxiety or depression, hyperthyroidism, epileptic disorders, epilepsy, fetal alcohol syndrome, hearing or vision impairment, Tourette syndrome, disorders of sleep, sleep disorder, Asperger syndrome, autism or autism. Some of these medical conditions listed here may cause symptoms that are very similar to ADHD. But the matter is not only that the symptoms are similar, but rather it is estimated that at least 1 out of every 3 children who suffer from ADHD suffers from one of these medical conditions, or other similar medical conditions. Diagnosing attention deficit and focus disorder in young children. Although symptoms of ADHD may appear in children at the age of compulsory nursery, or even in children at a younger age than that, diagnosing this disorder in very young children is a complex and difficult process. The reason for this is that problems that may arise during development, such as delayed speech development, may be mistakenly diagnosed as ADHD. Therefore, the diagnosis of this disorder in very young children should be made by an in situ specialist, such as a psychologist or psychiatrist, speech-language therapist, or child development specialist. Questionnaires and interview. Since symptoms of ADHD are not often visible during a routine medical examination, the treating physician uses a face-to-face interview and questionnaires to become more familiar with the child's behavior. The pediatrician may ask to speak to the child's teachers or other people who know the child, who are well acquainted with the child, such as the sitter who takes care of him, the coaches or counselors whom the child always meets. The doctor may also use a special stepper ladder to collect and evaluate information about the child. Treatment of attention deficit hyperactivity disorder. Treatments for ADHD in children mainly include medication and counseling. However, there are other treatments that help relieve symptoms, including organizing and defining a special space for the child in the classroom, in addition to family and environmental support, public drug treatment. Today, stimulant and sedative medications are the most widely used drug treatments for ADHD in children. It includes Ritalin, Concerta, methylphenidate/primary stimulant drug, methylphenidate, Adderall, dextroamphetamine/amphetamine, neurostimulant, amphetamine, dexedrine, dextroamphetamine. Although scientists do not know completely, yet, how these medicinal drugs work, the impression among them is that these drugs stimulate the brain and balance the levels/concentration of chemicals in the brain, known as chemical messengers between nerves, transporters/neurotransmitters. Neurotransmitters. These medications improve the main symptoms and signs associated with ADHD, such as attention deficit, impulsivity, and hyperactivity, to a very large degree, sometimes. However, the effect of these drugs only lasts for a very short time, and it disappears very quickly. Effects and side effects of stimulant drug treatments. The following are the most common side effects found in children when taking stimulant drug treatments. Loss of appetite, weight loss, sleep disturbances and problems, nervousness and lack of calm when the drug wears off. Some children who take this type of medicine may develop some spastic muscle movements, such as involuntary movements in the facial muscles or tics, tic, repetitive and inconsistent involuntary movement, tic. However, these movements stop and disappear when the dose is reduced or adjusted. In addition, these stimulant drugs may have the effect of slowing growth and development in children, but this delay is, in most cases, not permanent. There has been some concern and apprehension about the consequences of stimulant drug use in children with ADHD who are not yet of school age. Drug treatment for ADHD and heart problems. We have been, indeed, some of the deaths recorded as a result of heart failure, heart valve failure, in some children and adolescents who are taking these stimulant medications, but talk here about rare cases. Treatment with sedative drugs. This treatment is mainly used for children who suffer from ADHD and for whom treatment with stimulant drugs does not work, or for children who have symptoms and side effects from taking stimulant drugs. Other treatments used to treat children with ADHD include antidepressants, Catapres, Catapres, Clonidine, and Guanfacin, Guanfacin, Tinux, Tinux. These drugs are used to treat high blood pressure. It has proven effective in treating people with ADHD. Treating ADHD with counseling. Children with this disorder often reap great benefit from counseling and coaching conversations, or from behavioral therapy. All of these treatments can be received by a group of specialists, including a psychiatrist, a psychotherapist, psychologist, a social worker or specialists who are qualified in various fields of mental health and are licensed to provide these treatments. Some children with ADHD may have other phenomena, such as an anxiety disorder or depression. In such cases, counseling and guidance can help treat the disorder itself, in addition to treating the associated phenomena. Among the popular types of counseling are psychotherapy, behavioral therapy, family therapy, training to acquire social skills and qualifications, treatment by group support, parental skills training. The best results can be achieved from these treatments provided that teachers, parents, therapists, counselors, or psychiatrists work together, as one group, to achieve a common goal. Parents can play a central and decisive role by exerting efforts to coordinate joint work and cooperation with teachers, and by directing them to qualified and reliable sources to receive the information and support necessary to improve the situation of their child during the study. Prevention of attention deficit hyperactivity disorder. There is no way to completely prevent ADHD, but there are some steps that parents can take to prevent symptoms and problems caused by ADHD and to ensure the physical, psychological, and emotional health of the child as much as possible. Among these steps, during pregnancy, all practices and behaviors that may harm the proper development of the fetus, such as abstaining from drinking alcohol, smoking cigarettes, or consuming addictive substances should be avoided. The child must be preserved and protected from exposure to pollutant and toxic materials, including cigarette smoke, industrial chemicals, or agricultural pesticides, and paints containing lead, which may be found in old homes. Parents need to be persistent in their behavior, in setting clear boundaries and in drawing clear conclusions from their children's behavior. Parents should take care to build a constant daily routine for their children, detailing the child with the utmost clarity of what the parent's expectations and demands of him are, in everything related to the hour to go to sleep in the evening, the morning waking up, meal times, times to complete simple household tasks and times to watch TV. Parents should refrain from doing multiple actions when talking to the child, as it is necessary to maintain eye contact with the child when dictating instructions. It is also recommended that parents devote themselves to a few minutes, daily, in order to praise the child. Parents should fully cooperate with their child's teachers and therapists so that problems that may arise can be diagnosed as early as possible. When a child is diagnosed with ADHD, or any of the other disorders that affect his educational attainment or his social relationships, parents should realize that early treatment may help greatly reduce the impact on managing the child's healthy lifestyle. Alternative treatments. Little research indicates that alternative therapies may help significantly reduce the severity of symptoms that may accompany ADHD, although some of these therapies do contribute to that, indeed, it seems. Among the alternative treatments: yoga. Special diets. Most of the diets approved to treat this disorder focus on abstaining from foods that are believed to cause hyperactivity, such as sugars and caffeine, in addition to foods known to trigger allergies such as wheat, milk, and eggs. Some of these diets recommend that you refrain from consuming artificial food coloring and food additives. Research does not indicate, to date, that there is a consistent relationship between diets and the reduction of symptoms and signs of ADHD, although there is some research that suggests that certain dietary changes may have positive effects. Vitamins and mineral additives. Vegetable additives. There is no, so far, say a chapter in whether eating plant St. John S. League Heart/Herb Ern St. John's S word Hypericum, ginseng, ginkgo, traditional Chinese, or any of the medical drugs. Other medicinal herbs are useful in treating ADHD. Essential fatty acids. This group of acids, which includes omega-3 acids, are very vital in the functioning of the brain. Glyconutrients. This term refers to a group of 8 types of sugars that, in theory, help reduce and alleviate symptoms by contributing to the production of a vital basic structure called whey protein. Although it is well established that sugars are essential for the proper functioning of the brain, it is not clear whether these glucocorticoids have any effect on ADHD symptoms. Neurofeedback training. Neurofeedback records the electrical activities of brain waves. This therapy consists of a fixed number of sessions, during which the child is asked to focus on certain activities while the child uses a device that displays his/her brain wave combination. In theory, the child learns to maintain and control his brain wave structures, which are the waves emanating from the front of the brain. In this way, it relieves the symptoms of attention deficit and focus disorders. For any inquiries or questions, add your comment. And don't forget to subscribe and activate the notification to receive all new